I think healthcare is under a lot of pressure right now. People are feeling very stressed, and we have some issues of morale, and want to understand more about why we're there. And my premise is we have a bit of a collision going on in society. It's not just the U.S. It's many countries between one era of professionalism, the way I was trained as a doctor, just try harder, be noble, really commit to the patient, all of which we want to retain. But it was an era in which we were sort of taught we are the system. You know, it's us, and professional responsibility is what generates excellence. The second era is the one we're in now, really, which is different because of the evidence of healthcare not performing the way we hope it would in patient safety and patient-centeredness and certainly cost. We've entered an era of accountability and measurement and holding people's feet to the fire, rewards, punishments. These were not part of that first era, and I think we've created a conflictual environment, two worldviews that don't go well together. And I'm interested in era number 3, which is what would it be like? What would we like it to be like that resolves this dilemma where we don't glorify professions just as if they were superhuman, but still value professionalism, and don't run away from accountability and measurement because they're toxic. We need some measurement. What's the next phase? I think I'm believing that it's about purpose, that we need an era in healthcare, frankly, probably in public discourse, that is more comfortable with a moral vocabulary around the purpose, the reasons we're here. I think that's what the workforce wants to do. Here at the IHI Forum, you just go out there, you see the commitment people have, the energy they can bring to their work. We need to build on that. So I want to kind of develop a case for that third option. It's not simple for hospital leaders, and I don't want to sound naive, but I think it's about returning to purpose. I think it begins in yourself. If you're running a hospital, or you're the chief of medicine or nursing, or you're the head of an important department, why are you doing this? I don't think we get to an answer without individual people reconnecting to their purpose. That goes right up to the Board of Trustees. I know you want to have a good balance sheet. I know you want to be successful financially. I know you want to, you want to feel like you've done the right job managerially or administratively. But hold on a minute. Why are you there? And that's about suffering and the relief of suffering and really meeting needs. For a lot of boards and executives, that would sound naive. It's not naive. It's the route to success, in my view, in a very hostile climate. I also think it would reunify the professional ethos and the managerial ethos and the political ethos if we could come together around purpose. And I'd engage that. Start with yourself and openly talk about that in your community. That's a good place to start. The other thing that we know from IHI's work is get the patient and family in the room. If you need someone to re-clarify aims, it's the people we serve. You know, at the wonderful South Central Foundation system in Anchorage, Alaska, they use the term, they don't say patient, they say customer owner. And I know how hard that would sound to clinicians and to managers, but think of it that way. You know, what if that's the case? What if the patient's your owner? How would you behave? And what do you want to get done? And I think that would recalibrate directions.